Yes. Can everyone see that?
Yes.
Yeah. Oh, great. Thank you.
Good.
Good deal. Hi, Gina. Oh, she's just connecting to audio. Hey, Gina. Thanks for joining us.
Hello.
Give everybody just a few minutes to get going. Had quite a few people say that they were going to be on today, so thanks for hopping on here. Oh, somebody joined from 303. Is that Jamie, Tracy? Who's calling in from Colorado?
Lori. Good
Lori.
morning.
Hey, Lori. Oh, good to
stay on for a while.
Good to hear you. Hear you. Hey, Daphne.
You too.
Hello.
Was that Daphne?
This is Daphne. How you doing?
Good, good. It delayed and so it sounded like on my end, hello, 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 like almost like an echo. All right, we'll give everybody just a couple more minutes here to join. Hope everyone's been having a good week. Hey, Michaela. Thanks for joining.
Hello, I'm actually just in on audio because I'm in transport right now, but I wanted to log on.
Yeah, no problem. I know you told me you had an appointment today, or your daughter did. So thanks for joining.
Of course. Thank you so much.
No problem. We'll do introductions here in just a second. Give everybody just a minute more to join. Just writing down everybody that's on the call today. So hopefully don't miss anybody. Hey, Heather. Thanks for joining.
Hello, how are you?
Who is that? Good.
This is Rosie Peterson.
Oh, hey, Rosie. How are you?
I'm fine. How are you?
We're doing okay. Thanks for joining today.
Yeah, no problem.
Hi, Mariah.
Hi, thanks for having me.
No problem. All right, well, let's go ahead and get started, and I will, as people join, we'll catch them on the introductions at the end. But in interest of everybody's time, I want to go ahead and get started. So you are at the Genetic Ambassadors Call for Mountain States Regional Genetics Network for July 2020. I have a little agenda planned out for today. You should have gotten hopefully in a reminder email today. But I thought we'd start with welcome and introductions. We have a couple new folks joining us. And I thought we would start off by doing our name, maybe the group that you represent. If you don't represent a group, that's okay. You can just represent you, the state you live in. And then I have this, very, very thought-provoking question in the middle of July. Would you rather live where it only snows or the temperature never falls below 100 degrees? And you got to pick one or the other. So I can get started. I'm Christy Weiss. I'm the, now I will share with that in just a minute, but now the project manager of Mountain States Regional Genetics Network. And I represent Mountain States, of course. I also do my own advocacy business, helping families here and based out of Pennsylvania. I live in Pennsylvania, but my heart is in the Mountain States region. We moved here 7 years ago from Texas. And for my answer for the question, would I rather live where it only snows or the temperature never falls below 100 degrees? I would say I would live where it only snows. So the heat and myself do not do well together. It has reached about in the 90s here in Pennsylvania, which I know is not hot at all compared to the rest of the Mountain States region, but it's been a scorcher here in Pennsylvania weather. So I like the snow. So let's see, who wants to go next? I'll read off names that I have written down here. Lori, do you want to introduce yourself?
Sure. Just one second. Kind of got two meetings going on at the same time.
Oh, I'm sorry.
I'm Lori
Sorry.
Wise. Well, that's okay. Lori Wise in Denver, Colorado. I've been part of the group for, oh gosh, could be like 10 years or so. I'm also on the newborn screening stakeholders panel. They meet quarterly. At this time, it's virtual meetings. And other than that, I work full-time at Quorum Clinical Trials, and I would rather live, I don't like either of those, but I would prefer where it snows
In the
than
snow?
100 degrees.
Yeah.
Yes.
Sounds good. Thanks for joining us, Lori. Michaela, I know you're in transit, but do you want to introduce yourself?
Yes, absolutely. Hi, everyone. My name is Michaela Allison. I live in northern Colorado, just about an hour north of Denver. I'm originally from the Wyoming-Montana border, but I've been out here for 16 years now. And my daughter Lily has the rare disease Ehlers-Danlos syndrome, hypermobility type. And I am able to sit on the Family Advisory Council at Children's Hospital Colorado for 3 years now. And I also am a board member of Colorado Rare, which is a nonprofit here in Colorado that acts as a united voice for all those with rare health conditions. I also run a patient advocacy program I founded in 2017 that connects individuals with health conditions through an internal initiative called Be Kind. And I also love to do graphic design and have done that and branding for the past decade or so. So it's so nice to be here, and I'm super excited about this new grant cycle and what we're going to make happen.
And the $1,000 question, do you like the snow or 100 degrees?
Snow all the way.
Okay.
Yeah, I'm a snow bunny for sure.
All right, perfect. And how about you, Daphne? Do you want to introduce yourself?
Daphne Fulton. I'm in Texas, so I'll take snow on. So, and I work with, I have a grandson who has vascular Ehlers-Danlos syndrome, and I work with the VEDS community quite a bit. I do research on health-related quality of life for people with rare genetic conditions.
Perfect. Thanks. And how about you, Elvira? Do you want to introduce yourself? You might be on mute. We can't hear you. Okay. Can you hear us,
Who
Elvira?
did?
Oh. Okay. We'll come back to Elvira. Gina, do you want to introduce yourself?
Hi, I'm Gina Polameni. I'm in Utah. First and foremost, I'm the mom of 5 kids, 2 of which, unfortunately, have passed away from a rare genetic syndrome, and now have 2 adult children that have an undiagnosed, we don't know what to call it, just undiagnosed right now. I am the former founder of Utah Family Voices and have been with our Family Voices and our Family to Family and our Utah Parent Center, which is the PTI in the state, for about 30 years, and just recently retired, but have kept some things that are near and dear to my heart. One is I'm chairing our state legislative coalition for people with disabilities, and continue with the medical home portal in helping to get resources and information out for all conditions, as well as family faculty for our, it's called Utah Regional LAND, which is the Leadership Education in Neurodevelopmental Disability. So thank you for having me. And I'm actually gonna go the other way. I want.
You want heat?
I want heat.
Sounds good. Thanks for being here, Gina. And let's see, Hannah, are you still on? Do you want to introduce yourself?
Yes. Hi, everyone. My name is Hannah Barnhart, and I used to live in Alaska, and I used to manage the only pediatric genetics clinic up there, and I'm now in Nevada. And I'm one of the co-leads for the state team for Mountain States. And I guess I'm with Gina. I would prefer the 100 degrees because yeah, I lived in Alaska for so long. I'm done with snow.
Which is now why you're in Nevada. If you like 100
That's
degrees,
right.
right? Awesome. Thanks for being here, Hannah. How about you, Heather? Do you want to introduce yourself? We can't hear you. Oh, can you unmute, Heather?
I'm having technical difficulties. Can you all hear me? I have that my microphone sounds like I'm on a rocket ship lately. So I apologize.
I can hear you. You're good.
I'm Heather Schichtel. I'm with the Colorado Consumer Group. I run a nonprofit. I'm the executive director of a nonprofit called Miracles for Mito. We're the only mitochondrial awareness group serving the whole Rocky Mountain region. So from Montana all the way down to New Mexico. I got involved, both of my children had full G1 deviation that manifested as mitochondrial disease. And my brother now has an adult onset mitochondrial disease. So we support research and advocacy on the Anschutz campus. And super happy to be a part of this group. My big passion is really trying to shorten the diagnostic journey. So trying to make it easier for all of the families to get a genetic diagnosis faster. In response to cold or heat, put me in the cold, give me the snow. This 100-degree heat, I'm like a wilting flower right now. So stinking hot.
Thanks for being here, Heather.
Thank you.
All right, Melissa, you're up next.
Okay, I am Melissa. I live in Texas, and I will take the heat over the snow. I've never been around a lot of snow, wouldn't know what to do with a lot of snow. And in Texas, when we get snow, then we get ice, and that doesn't go well. Nobody goes anywhere because everybody ends up in a ditch because we can't drive on ice. And there's AC and there's swimming pools and showers to cool off, so I'll take the heat. I am co-lead for the Texas team of Mountain State estate teams. I work at Texas Parent to Parent, which is a statewide nonprofit. We help families find the resources they need and connect with other families who have a similar diagnosis or situation that they're going through. I have a 28-year-old son with Down syndrome and a 32-year-old son with a learning difference, anxiety disorder, and some food sensitivity. So we're not 100% sure what's going on with him.
Thanks for being here, Melissa. And how about Christine? I saw Christine's name pop up. Are you still on, Christine Tippett?
I am here.
There you are. Go ahead.
Hi, I'm Chris. My son, 7-year-old son Cooper, has mucopolysaccharidosis type 4A. I got hooked in with Mountain States when Dr. Thomas said, "Hey, you like to speak your mind. Would you like to hang out with us?" And I said, yes. And that's how we got started. I'm in Colorado, and give me the snow.
Give you the snow. You guys, you all call you Coloradans are the same. You all like the snow. That's, I guess, why you're there. Great. Thanks for joining
Yes.
us. I'm glad you're here. How about you, Rosie?
Thanks for having me.
Are you on still?
Okay.
Rosie?
Yeah, I'm on. I'm Rosie Peterson. I'm in Texas, in McKinney, Texas. I work for the University of Texas at Dallas as the Director of Institutional Diversity Initiative. And I come from Mobile, Alabama, where I work with the University of South Alabama, where I worked some years ago with the university's healthcare system we had a 1115 waiver where I worked with the aged, blind, and disabled population to help identify the gaps in the healthcare delivery system for the state of Alabama. I worked 18 years for the community program for sickle cell, and I served on the board of the National Sickle Cell Disease Association several years as the board chair. So, and I love an afternoon shower from the Gulf. So I like the hot weather.
You like the heat.
What did you say?
I said you like the heat.
Yes, yes.
Good. Well, thank you, Rosie, for being here. We're glad you're here today. And let's see, I have Winton. Winton, do you want to introduce yourself?
Hi. Hi. I'm Winton Wood. I am here in New Mexico, and I have a daughter. Well, I have two daughters. My 14-year-old daughter, Lilia, has Down syndrome and autism and other medical conditions. And I am also a MEVIA consultant. I work at UNM, the university here, which translates as MEVIA is our self-direction. Sorry, that's my phone buzzing. Is our self-direction developmental disabilities waiver, and I'm called a consultant, but it's really like a case manager. And I love snow, but that tells me that the sky would be gray, and I need sun for my eyes or I get depressed. So I'll go with the heat, which hopefully indicates sun.
There you go. Sounds good. Thanks for being here, Winton.
Thank you.
All right, next I have up Susan. Susan, do you want to introduce yourself?
Yes, I will just say that I want to second Winton's emotion and say that I lived in Nashville and we had snow all the time. And then we moved to Dallas and I love the sun. So even I put up with 100-degree weather to get the sun. But anyway, and so anyway, what I do, I have done autism biomedical research for about 25 years. And also that morphed from studying sulfate and sulfur in autism into looking at oxalate. And then the oxalate project took me into all kinds of chronic illness. And so now I do consulting for a lot of people that have chronic illnesses that they can't figure out how to get well. And I'm definitely trying to push the genetics agenda to try to figure out if they can figure out what's going on with them. And so it's morphed over time. And also in my own family, we definitely have genetic issues that are undiagnosed. And so I'm all with you who are in that same place of just trying to figure out what's going on.
Thanks for being here, Susan.
Thank
you. Your vote's for the heat, right?
Yeah. Well, yeah.
Or just sunlight. The sunshine.
Just the sunlight.
All right, great. And then I think we have two new guests. It's our first time being here. Allison, did you want to introduce yourself?
Sure. Thank you, Christy. Hi, this is Allison Bones. I represent Team for Travis. Travis was my 4-year-old son who died of isolated congenital asplenia, which means he was born without a spleen. It's a genetic disorder, and no one ever diagnosed it in Travis until the autopsy, and the medical examiner discovered it. So I started Team for Travis, Together Ending Asplenia Mortality. We're moving into our 2nd year. I live here in Phoenix, Arizona, so just from my choice of residence, it's probably pretty obvious I'm going to pick the heat. Thank you.
Thanks for joining us. Thank you, Allison. And Mariah, I think this is your first time as well.
It is. Thank you for having me. I'm Mariah Gillespie. I am the mom to 2 rare disease daughters. They both suffer from a recessive genetic condition that is technically still diagnosed, though we have a high likelihood candidate gene that will be the first of its kind discovered. I run a nonprofit called the Lightning and Love Foundation that is doing research into this disease with the secondary goal of being part of the change of future from treating genetic diseases individually to treating them more generically within N of 1 treatments. So definitely part of that ultra rare genetic community and driving science for those people. Specifically, I also sit on the Colorado Developmental Disabilities Council, and I am the chair of the project and grants committee for that council. I live in Centennial, Colorado, so just about 15 minutes south of Denver, and I'm originally from Texas. So give me a pool any day. I'll take the 100-degree heat as long as I have sunshine.
Oh, good. Thanks for joining us. Nice to have
Thanks
you.
for having me. Yeah.
And I'm going to ask if I've missed anyone because there's a couple numbers that I don't recognize, so that don't have names with them. So anybody else that's on the call that I haven't called on yet?
Yes, Christy, this is Mary Meeker from Reno, Nevada.
Oh, hi, Mary. I didn't recognize your number. Sorry. Go ahead.
No problem. No problem. So I'll just do a quick introduction. My name is Mary Meeker, and I'm currently the Executive Director for Family Ties of Nevada. So we help families that have children with special health care needs identify resources. We're mainly a resource hub for families. I have a daughter that I adopted when she was young, who was diagnosed with fetal alcohol syndrome and is doing well. She's 21 and doing quite well. And in terms of snow or heat, I would take fall, but I guess I would have to take heat if that was my option over snow.
Gotcha. Glad you're here, Mary. Thanks for joining us. Anyone else on the call that I didn't call on or hasn't had the chance to introduce themselves?
Christy, this is Elvira.
Yes. Oh, yay! You got off mute. We couldn't get you off mute. Go ahead.
Yeah. My name is Elvira Dennison. I live in New Mexico, and I work with Navajo Family Voice as a family mentor. I prefer the snow, so this is, I think, my second year.
Mm-hmm.
I think that's about it. But I am an active parent in my school district. I was appointed last October with the New Mexico IDEA State Advisory Panel here, so I'm really excited. I got interested into the Mountain States Genetics Network because I did have an uncle who had Down syndrome. He passed away 2 years ago, so there wasn't enough resources out here for him on the reservation. I live on Knox City, New Mexico, on the Navajo Nation.
Thanks, Elvira. And you like snow or heat?
I like snow. It's too hot here.
Too hot here, yep. So glad you're here today. Thank you. Anyone else on the call that hasn't gotten a chance to introduce themselves?
Hi, Christy. This is Amy Wagner.
Hey, Amy. How are you? Go ahead.
I'm good. My name is Amy. I live in Phoenix, Arizona. I have a daughter, my youngest. I have two daughters, but one, my youngest, has a rare genetic disorder called Turner syndrome. I myself have a rare genetic disorder as well called retinitis pigmentosa. I definitely prefer the heat over the snow. I don't do cold very well.
Which is a good thing you're in Arizona, right?
Yes, it is. Yeah.
Great. Thanks for being here. Glad you're here. Okay, last call. Anyone else? I'm scanning through. I think I got almost everybody, but if anybody's on there that's called in, we good? All right. Well, I'm going to go ahead on to the next slide. We're going to go over some of the new grant initiatives. We're going to do some brainstorming together, and then I've got some announcements for what's coming up. So as I said, I've got a new position this grant cycle, which I wanted to let you guys know about. I've been asked to take over the role of projects manager for Mountain States and have excitedly accepted. Excited to take on this new role. And for some of you who are newer to the call, I came to Mountain States just like many of you, looking for answers for my daughter, who was suspected at the time of having a mitochondrial disorder. My background's in chemistry, and my passion is for empowering families to make informed decisions for their children and themselves for their health. And so I'm taking on a little bit different role, but I'm still wearing the consumer engagement consumer advocacy hat, so that hasn't been taken off my plate. So I'm excited about that. That I'll still be working with our individuals and families in the Mountain States. I wanted to take a minute to step back a little bit and just give you guys a little bit of background on Mountain States, but also introduce you to our management team, who's never on these calls, but I thought it would be a good idea just for some new folks joining us, and for those of you who've been here for a while. We just had a retreat yesterday via Zoom for 4 hours. And so this is our team. So Mountain States is a small organization. We don't have tons and tons of employees, but there's some of the core group of us that run this grant. Ankit here is as a CEO at Texas Health Institute. So Texas Health Institute is based in Austin, and they are what we call our fiduciary agent, which all that really means is they are the nonprofit that holds the grant money from the government that funds Mountain States. So you'll hear us say THI or Texas Health Institute. That's who we're referring to. So Ankit runs that organization and is our project administrator, our grant administrator. Kathy and Janet there in the center are our two project directors. They are both medical specialists. Kathy is a hematologist. She works mostly with sickle cell patients in the genetics arena. And Janet is a metabolic geneticist, and they're both from Colorado. And Janet's a pediatric metabolic geneticist at Colorado Children's Hospital. Joyce there on the right has been with one shape or form of the Mountain States group since 1985. These grants go back to. And so she leads up our state teams, which I'll talk about in just a second. She also lives in Colorado. Then at THI, we have Stephanie and Katie, and I put them on here because we mostly work with them, or our consumer group mostly works with them or hears from them when we're planning our genetic summit and doing consumer scholarships and coordinating travel. So Stephanie and Katie work together on meetings and convenings, and they are both in Austin at THI. Liza is our evaluator. She counts everything that we do and helps us prepare reports and show back to our funders what we have spent their money on and what impact those initiatives have had. Liza, a little bit of history. Liza used to be the position that I have now, the programs manager. When I first reached out to Mountain States, I picked up the phone and called Liza, and she was on the other end of the call when I found Mountain States on a web search, a Google search, probably about 9, 10 years ago now. And Sherry there on the right is the COO, Chief Operations Officer at Texas Health Institute. So she does a lot of the work with the financial pieces of the grant, reimbursements, and those types of things, and human resources. So that's our team. Most of you that have been on the call know our 8-state region. We cover over 1 million square miles, which I always cannot believe that's how much land we cover, but we cover a huge swath of the middle of the west of the country there. For those of you new to the call, you might not realize, but most of our states only have one center where you can access genetic services. We don't have anybody on from Wyoming today, but our Wyoming state does not have a geneticist in the state of Wyoming, and most people don't know that. Of course, Texas is a little different, and there's lots of places you can access genetics in Texas, but most of our states have one academic center that as a point of access. I made this little timeline because I think with the start of a new grant cycle, it's kind of helpful to look back and kind of understand where Mountain States has come from. So as I mentioned, there's been some way, shape, or form of the Mountain States genetics group since 1985. Joyce has been part of it from the start, as I mentioned. I got involved around 2012 when Mountain States was just starting a 5-year grant cycle. They had a little different acronym back then. They were called MSGRC, which stood for Mountain States Genetics Regional Collaborative. And as I said, it was a 5-year grant cycle of very heavy emphasis on newborn screening conditions in that 5-year grant cycle. In 2017, we had a change in name. We had to make a new logo. We got a new website because they changed it from a collaborative to a network. And we got renamed as Mountain States Regional Genetics Network. And that was a 3-year cycle. And that just ended in May of 2020. So many of you have been involved with that. Our Genetics Ambassador program was born during that cycle, and we still have that today. And then on June 1st, we started a new grant cycle. They didn't change our name, so our name is still the same, MSRGN, Mountain States Regional Genetics Network, but we have funding, we have a grant for 4 years. We have funding guaranteed for the first year. Each year we have to non-competitively reapply for funding, and that's all based on federal budgets. We are funded by HRSA, which is Health Resources Service Administration, their Maternal and Child Health Bureau, and their Genetics Services Division. So we are at the very beginning of a new grant cycle, which is super exciting, I think, because I was involved with the grant writing process this time, and it's been really neat to see the whole cycle come to life. So just a note, I just wanted to have this slide in here because we talked a lot about on our retreat yesterday about Mountain States culture. And this is something that you'll probably see the slide again in other ways, shapes, and forms. We're talking about doing a one-page document about it that can be shared across our region. But I just want you guys to know that the Genetic Ambassadors group came out of the culture of Mountain States. When I got involved, and going all the way back to 1985 when Joyce was first involved. But everyone in Mountain States is viewed as an equal and integral member of the network, and that includes consumers and family members. I have not come across an organization yet that has this level of focus of making sure that everyone at the table is heard. And everyone at the table feels comfortable that they are no lesser or higher than the person sitting next to them. So I just want to reiterate this. Some of you know this from being part of Mountain States, but whenever our groups include consumers or family members, they're not including them just to check a box. They're including them because they want to hear the consumer and family voice, and want to hear your experience and want to hear you as an equal expert on the team. Another piece of our culture is family first. I've often talked with individuals in our network that say, oh, I'm so sorry I couldn't make the call because my child was in the hospital or I had a doctor's appointment. I want you all to know you never have to apologize. Family comes first for all of us, for everybody at the table. Family comes first, and that's important. Another first is first names. Some of you know this as well, but when we gathered together in person, which hopefully will happen soon, we are on a first name basis. So we drop the titles. We try to do this on our conference calls as well, but you don't have to address people as doctor or whatever other title they might have. We are all on a first name basis. And so there's no need for a title or letters before or after your name. And then the other thing to know is that we represent all genetic conditions. And this is a little bit different than maybe some other groups you might be involved with, because I know a lot of you have very specific diagnoses or conditions. So you might be involved with groups that represent that. But our organization is not disease specific, but we have to represent, because of our funding, individuals impacted by all genetic conditions, which is a really different way to think about things. And took me a long time to get my mind around that, because that's a lot of different diagnoses. But we're looking at things that kind of at that 50,000 foot level of what are some of the things that impact every disease, not every genetic disorder, not just one specifically. And I wanted to share this quote with you because I shared it with the management team yesterday. We had our theme for yesterday's retreat was Camp MSRGN, so we did a little camping theme. And I had found this quote: "The wilderness holds answers to questions we have not yet learned to ask. So I added the word genetics to it today, but the genetics wilderness holds answers to questions we have not yet learned to ask. And I always look at our genetic ambassador group as the ones often that come up with the questions we haven't asked yet. So please be encouraged to know that your voice matters, and I'm so glad you guys are here today. So on to the grant cycle. These priorities have not changed dramatically for this grant cycle. These are the three main priorities that we responded to in the grant from HRSA. They asked that, number one, there be a regional infrastructure. And so what Mountain States has decided to continue on with for the regional infrastructure is our state team model, where each one of our states has a team. And we are so excited, we just had a call this morning, but 2 of the other regional genetics networks are going to implement this model during this grant cycle and are coming to Mountain States and asking for advice on how that works. The second priority area is education, and there's going to be an added focus this grant cycle on increased education to primary care and pediatricians about genetics. In addition to the work that we've done on education for individuals and families, but you will notice in some of the programming that there is an increased focus in the pediatric and primary care area. And then last but not least is telegenetics. This has been a big theme for many, many years with Mountain States. It's an ongoing focus in our region. We wrote the grant pre-COVID, and so the things that we have proposed look a lot different for telegenetics in the world that we're in right now. So we are waiting for some guidance, I guess, from our funders on what this will look like for this grant cycle. So stay tuned on that piece. So there's a couple programs that you guys will recognize who have been here for a while that are not going away. They are going to stay. We've written them into the grant. One is this program that we're meeting for right now, the Genetic Ambassador Program. We are going to make a slight change and go to quarterly calls where we had been previously meeting monthly. We are going to be going to quarterly calls, and I'll explain why in a minute. I know that will make some of you sad, and I apologize, but I want to share some exciting things that are coming out of the Genetic Ambassador Program. On these calls, I hope to continue to do guest speakers and other topics, and we're going to brainstorm about that in just a second. The other thing that many of you have been involved with is the genetics pop-ups that we started in year 2 of the last grant cycle. And we have funding, again, for 8 pop-ups per year for all 4 years of the grant cycle. So I'm excited that this will continue on. The next round we're looking at is Rare Disease Day 2021, and those applications usually come out in December. So stay tuned for those. But that's not going away, that's part of this grant cycle. The other 2 things that will remain, as I mentioned, the state team model will remain. We have 8 state teams led by 2 co-leads and consisting of a multidisciplinary team in each state. Many of you are on those state teams. They are made up of everybody from genetics providers to public health individuals from the state, consumers, families, primary care docs. And so that's going to remain. And then the Genetics Summit is also still on the books. Unfortunately, due to COVID, we've decided not to hold one in person this fall. We are looking at getting together in person in October, November time 2021. So stay tuned for more details on that. Obviously, a lot is going to have to do with the situation around the country and in our region with COVID. The 2 new initiatives that we are excited to launch are something called Genetic Navigators and our 40 Clinic Initiative. And I'm going to tell you a little bit about each of those in a little bit more depth here on these slides. So the Genetic Navigator Program is the reason that we're going to a quarterly call for the genetic ambassadors. The Genetic Navigator Program is really come out of the Genetic Ambassador group, this group right here that is meeting, with an idea that we proposed in the grant cycle to have 8 genetic navigators, 1 in each state of our region, trained and equipped to help families navigate the genetic system in their own state. It will be stipend funded program It's not a full-time position. It's not a hourly position. It's not a salaried position, but it is stipend funded. And we hope to recruit individuals and families who have experience navigating the genetic system in their state themselves. Many of you might be interested in this program. My hope is many of you might be interested in this program. These individuals will also serve on the state teams and work really closely with the state teams. And the idea here is to help put boots on the ground, if you will, in the state of somebody who's already been there, done that, and figured out how do I overcome the barriers that might be there to get to see a genetics provider and help to get testing or answers or information for my family. So the plan is to have applications out for this in December, and genetic navigators in training by the spring of this first year of the grant. And just a note for those of you new joining us, our years in Mountain States don't look like the calendar years. We start in June and end in May. So when I say year one, it's year one goes from June 1st, 2020 to May 31st, 2021. So this is an exciting new program because this is actually putting individuals in a position where they can help other families in their own state. And then the other initiative that we proposed is called the 40 Clinic Initiative. And then I mentioned that we're going to have a lot more focus on education for primary care providers. And this initiative is hopefully going to address that. We're going to strive to get 5 clinics identified by the end of the grant cycle. So in the next 4 years, 5 clinics per state identified times 8 states, which is 40, where we get the number 40. We're going to start off with 1 clinic per state to start off, and we're asking our state teams to help us identify all these clinics, but the first round for sure. We hope it will be a warm handshake where somebody on the state team might already have a relationship with those clinics, and the idea is that Mountain States staff, myself included, will come around those clinics and provide them with already developed tools to help them do genetics in their clinic. And you say, well, why would a pediatrician be doing genetics in their clinic? There is a lot that a pediatrician and a primary care provider can now do before a referral to a geneticist is made. And many of you know, just from your own experience, that the time to see a geneticist in our region can be long. And so there's another thought that there's a lot that can be done during that waiting time that can make that genetics appointment even more impactful once the time is up on the waiting list to see the geneticist. So we're really excited about this program. More to come on it, lots of program development going on with that right now. But again, hopefully by December, that first round of clinics, so 8 clinics, 1 for each state, will be identified, and we'll have them on board by right at the end of the first year, so right around April, May timeframe. All right, with that, I'm gonna stop for a second and see if anybody has any questions about any of the grant cycle stuff. Does anybody want me to give you any more details? I might not have all the details right now because a lot of it's still being planned, but does anybody have any questions?
This sounds really exciting, Christy.
Thank you, Daphne.
I think it's got so many possibilities. It's just, my mind is just racing 1,000 miles an hour.
So is mine.
I imagine.
So yeah, I've been deep into timelines over the last 3 weeks, is kind of planning this out on how this rolls out over a 4-year period. So my mind has been full of details. So anybody else have any questions? You can put them in the chat too. I just checked the chat box. And actually,
I just want to ditto Daphne. It's very exciting. Very, very.
Good. Thanks, Winton.
Congratulations, by the way.
Thank you. Thank you. So if everybody can open their chat box, you'll need it for the next part. So if anybody can find your chat box, it's on that bar. If you might have to wiggle your mouse, and when you find that bar that says like mute and stop video and pause, share, that stuff, there's a ... that you can get at the chat. Does everybody see their chat? Whoops, sorry. So we're going to do a little brainstorming session. Since we have so many people on the call, it might be hard for everybody to get a word in edgewise. I still want you to speak up if you would like to, but use the chat box here because then I'll have a record of what everyone's responses were too. But our Genetic Ambassador program is going to continue, and I want to make sure that it's the best to suit those of you who join each month or have been joining each month, who will be joining each quarter. And so I want your ideas, and many of you replied to my email where I kind of was asking, do you still want to be a genetic ambassador? So thank you for all of those ideas as well. But I want to get some ideas on topics. What genetic related topics are you wanting to learn more about? So if everybody can take just a quick minute and put those in the chat box, that would be great. Those can include really, something very specific that might be, again, if it's condition specific, it's hard for us to do because it only reaches out to one of those genetic disorders. But if it's more general, then we might have more of a chance to do it because it would be more applicable to more people on a call. But if you have some ideas on some genetic topic areas, that would be great. If you could put that in the chat box right now. I see some.
And Christy, I don't have access to the chat box because I'm on my phone.
Yep, sorry. Go
That's
ahead.
Okay. But I just want to let you know, I'm really looking for just an overview. I think there's, the more that I dive into this role, the more I see that there's just so much I don't know. So, I think an overview of genetics in general and that kind of thing, I would definitely be open to. So nothing real specific for me, but, just a broad-based knowledge of,
Perfect. Thank you, Mary. I just typed that in the chat box, so I recorded it. So thank you, Mary. That's a great idea. Does anyone else on the call who doesn't have access to the chat box want me to record something in the chat box that you'd like to share? Lots of things coming in. So I see Medicaid coverage, available types of genetic therapies, pushing our states to adopt everything on the RUSP. For those of you who don't know what that is, that's a recommended uniform screening panel for newborn screening, medical triage during times of crisis, mentoring families new to the genetic scenery, how genetics can improve newborn screening. Thank you guys, great ideas. Okay. I'm going to go on to the next one, and this one is speakers. I have heard some feedback that people really like when we have speakers on. So if that is true and you all agree, if there's somebody you would like to hear speak to our group, either you've heard them speak before or you haven't heard them speak and you would like to hear them speak, or even if you don't know who that person is, but you know the type of person you'd like to hear speak, could you put that in the chat box for speakers. Some of the speakers we've had on in the past include, we had Annie on from Expecting Health and Genetic Alliance talking about their new online parent training program for about newborn screening. We had Emily talk. She's a resident at Colorado Children's Hospital. She had a project that she was working on that she was recruiting some families for, reviewing parent sheets for newborn screening. We've had Beth from Family Voices was talking about a family engagement checklist or tool to help assess family engagement. We've had a number of different speakers, but if anybody has any ideas on speakers, again, even types of speakers. I don't know if Jamie's on today. Jamie had suggested in one of her emails about having even individual researchers or those physicians doing genetic research to even come and do a presentation and talk. So if that's interesting to you, go ahead and mention that there too. Give everybody a minute. If there's anybody on the phone that has ideas about that and you want me to note that down, please feel free to unmute your line and let us know. I see some coming through. So more about consumer genetics and expectations of how that overlaps with what a geneticist does. Dr. Austin Larson and Julie Vittorella, I don't know how to say that last name, Julie founded Mila's Miracles and lives in Boulder. Matt Might on his journey from diagnosis to treatment. I just saw another one. Oh, Hannah said geneticists or genetic counselors for them to share expectations for families regarding the initial appointments. Great ideas, everyone. Okay, and then last but not least, I'm gonna go on to training. Oh, Susan Fernbach, good idea, Daphne. All right, so I'm gonna go on the last box here, reply and chat box for this one too about training. Are there any skills that you feel like you are missing or some type of training you would like to attend that relates to genetics? And just to give a little background for those of you who might be new to the call, when this genetic ambassador group started, we did something called Serving on Groups training. And it was from Family Voices. That's where I received my Train the Trainer training from. And it was how to serve on decision-making groups. So many of you have mentioned them in your introductions. You know, Elvira said she was on a group for her school district, and Michaela said she was on an advisory council for the Children's Hospital, and many, many different groups out there. And so this training was really how to serve on a group and get your voice heard, and also just different aspects of serving on a group. So that training is archived. We recorded those calls. So if you want to go back to our Genetic Ambassadors tab on our website, you can listen through some of those trainings. But I'm just curious if there's any other trainings out there. Not that if you don't know what they're called, that's okay. But like, is there anything for, if you're running a nonprofit, are you looking for some training in that area? Are you looking for leadership training? Are you looking for any other types of advocacy training? So if there's any ideas on that, please pop those in the chat box as well. So I have one. Winton says training on screening, not newborn screening, i.e. if the newborn screening was missed. Can you elaborate on that, Winton? I don't know if I'm quite understanding what you mean.
Yeah, sorry. I know like Colorado does a lot of webinars on newborn screening. We're talking a lot about newborn screening. What I see when it comes to our vulnerable populations, we have a tendency, and I understand why, to focus on newborns or 0 to 3 or the little guys. And then the other ones, unfortunately, including young adults or older adults, are forgotten. But they still are there, and they still really need a lot of supports. So if there are screenings going on for lay people like me or pediatricians or other doctors, primary cares, about we have some suspicions, what do we do next? Where do we go to? We've
something maybe called like red flags, like how to identify maybe genetic red flags in older children or
older children, young adults. And also I emailed you, Christy, about, you know, how I do those didactics with the pediatric residents at UNM.
Right.
When they come to the Center for Development and Disability. And I'd really like to have, I don't care what the training is, but anything that I can incorporate a didactic with them to expand their knowledge. So anything that you guys want to give me that I can take to the residents, because all of the residents at UNM have to do a 1-month rotation at our AUCD. So
okay. Yeah.
Go to the clinics, but I sort of right now have the flexibility to create some things.
Okay. Let's talk offline on that, Winston, because I've got some ideas on how that might piggyback into the 40 clinic initiative.
Cool. Okay.
Hey, Christy.
Yeah.
Oh, sorry to interrupt. I was having trouble because I'm in transit, but I wanted to mention 2 things. Yes, I would love researchers to come in and to speak a little bit. I think it'd be so interesting to kind of see where things are at within different levels of exome sequencing and things that are going on, especially some of us who have either ourselves or our kiddos had sequencing done years back, and kind of where are things at now and how have they changed within different areas and sectors. And then the other thing, kind of combining number 1 and number 3, one of the biggest things that I could see as a benefit that perhaps Mountain States could provide would be some sort of training or resource for individuals who are diagnosed with for example, rare conditions, more than half of the 7,000 rare diseases have no foundations yet built to support them. And a lot of those most of those are genetic in nature. And sometimes, individuals are receiving these diagnoses and they would like to step forward and maybe bound together and find partners to work with and form nonprofits. And when you've not been in this industry at all, and then your child is diagnosed with a rare disease or you're diagnosed with a rare disease, it's a whole new world. So to have some sort of support and base, and for perhaps, us here to be known to be able to provide that, and to, be a referral from organizations like Global Genes or someone to, come in and help support some of these individuals or small groups in, making an impact, whether it's just starting out and having a support group, or whether it's moving forward and initiating research or participating in conferences or whatever that could look like. I think that we could really make an impact that way.
Yeah, great idea. Thank you. And Daphne put a comment here, maybe partnering with NORD on some of that. And you said Global Genes. So great ideas. And for sure, it's so overwhelming just to get a diagnosis alone. And then the thought of starting a nonprofit is daunting, right? So great idea. Thank you, Michaela. I noted that down in the chat. All right, so many good ideas. I don't want this conversation to end, but due to time, I want to make sure we cover a couple other things. So please, I will share my email address at the end. But please, if something pops in your head after this call ends, or you haven't gotten a chance to type it in yet, please send me an email. And I'm gathering all these together from the emails you've already sent me, and I was just going to show this slide. These are some of the things that I got from the emails that people sent back when I asked if you still wanted to be a genetic ambassador for this grant cycle. So these are already some things that I have listed down, and some of them mirror what was said here today. So that's good. I can take this list and overlap it with the other list that I'm making here today in the chat box. But these are some things that came through via email. So thank you guys for all this input. And Daphne says, Corey, and Allison says, how to attract families, patients to expand your patient community when you support an ultra rare disorder. Great ideas. Okay, so I'm gonna move on. One other thing that had come up, back to the idea that you were saying, Winton, about the red flags. I call them red flags. I think that's kind of what you were describing in older children and young adults. At one of our genetic summit, we had a roundtable discussion. Some of you were there, I think, and we talked about some things that the genetic ambassadors, which was just starting up at the time, could do that would be helpful for families. And as I'm thinking through some of these new initiatives, and especially this 40 clinic initiative of how to how to equip primary care clinics with genetic tools, one of the topics that has come up is red flags for pediatricians and primary care doctors. And there was a conversation at that genetic summit with our genetic ambassadors about red flags as reported by parents, by families, for families. And so I have a list. I found it the other day. I apologize, it got buried in a pile, but I've been cleaning house. And I found it the other day. And so I wanted to pick up this discussion and see if this group would be interested in following through with that and taking that list and maybe expanding on it. Some of the things up here are just a couple of things that were on that list, but I know there's probably hundreds more, and every one of you on this call probably has a different red flag that you might have a personal experience with for your own child or loved one. So I wanted to just see maybe a show of hands for those of you on camera, or put in the comments if you guys would like to take this on as a genetic ambassador project. I don't think it would take a lot of time. I think we could do, via maybe like a survey monkey or something to gather everybody's responses. Would this be something that everybody would be interested in? My hope would be then we could use it to then share with pediatricians in that 40 clinic initiative. I see a yes from Heather, a yes from Susan, a yes from Winton, a yes from Hannah. Okay, see some more. Okay. So it sounds like this might be a go. Okay, so be thinking about that as you're talking with people over the next couple months. You might be wanting to ask them what was the red flag if their child's gone on to receive a genetic diagnosis. Maybe ask them what was your first red flag. What did you notice? And jot those down. I've done this before on my Facebook page. I've just put it out there for those of you diagnosed with a genetic condition or have a child with a genetic condition. What was the red flag? And I've gotten hundreds of responses. So anyway, that's another way you can gather some information from your community. So I'll go ahead and put this on the agenda for next month. And this last thing are some announcements. Just want to wrap up with these. I've been asked to be on a national work group for ACMG on genetic discrimination. And I am just curious, we're not going to talk about it here today, but I just want to put this out there. If anyone has had experience with this, or has had a personal experience with this, or just has thought about the topic, or read about the topic, or had concerns about the topic, would you email me? This is going to be rewriting a paper that was put out almost 20 years ago. It's not a paper, it's a points to consider document. But it was written before the legislation came about called GINA. If some of you guys are familiar with that, the Genetic Information Non-Discrimination Act. And so it's in great need of updating. And so I'm on this as a consumer, as a family member, representing all of you and many more. But I want to make sure that I'm representing everybody's voice. So if you have any experience with this at all, please email me. The second point here is the cost of rare disease survey. I put this on our Facebook page, our Mountain States Facebook page. I just heard that the deadline for this has been extended to, I think, August 3rd. It's also in the Genetic Ambassador Facebook group. But I just wanted to point your attention to this because I have never seen data or a survey like this in my time in genetics. So they are really going to try to put a number with survey data to the cost of rare disease. So I highly encourage you to take a look at it, answer it for yourselves, or share it with your communities. If you need the link, just send me an email and I'll send you the link. Also, I participated in the Global Genes Rare on the Road and Nord Living Rare Forum in the last couple months. And wondering if anybody else on here got a chance to chime in on those. I just found out that the Living Rare Forum has a discount code where it was recorded because it was virtual, and I think you can access it. So I had reached out to them. I haven't heard back yet on what the price would be. So as soon as I get that information, I can post that in the Facebook group for anyone who wants to watch the recording of that. And then one last question I have, because we're right at the top of the hour. We had talked about having a calendar, and we kept that, I think, for probably the last half of the year. With us going to quarterly calls, my question is, would you guys like to continue the calendar? And if so, in this world of virtualness that we're in right now, I know a lot of in-person events have gotten bumped to virtual platforms. So type in the email or in the chat box if you have any ideas on how we can do the calendar, if you'd like to keep the calendar. We were really using it just to keep everybody on the same page of things coming up. So, and last but not least, for everybody that is looking for where all the stuff Genetic Ambassador related is, it's under the For Families tab on our website. And for anyone who has not been added to our Genetic Ambassador Facebook group and would like to be added, just send me an email. I need to send you an invite to the email that you use for Facebook, but that's where I post a lot of these links as well, and also on the Mountain States Facebook page and Twitter accounts. So there's my information. Sorry to rush through the end there because we're 1 minute over, but I am so glad you guys could all join us today. I'm super excited about some of the stuff coming up in the next couple months and years with this new grant. And I'm always available to talk to any one of you that wants to chat further about any of these initiatives or any ideas you have as well. So that's that. I will pause there. If you have to jump off, totally understand. If you wanna make some comments, I'll stick on here for a few more minutes if anybody would like to chat.
Hey, Christy, this is Daphne. Did y'all talk about internships?
I just sent an email off this morning. Our agenda was packed yesterday, so I didn't get a chance to talk to it on the call, but I just sent Kathy and Janet an email. Does anybody else have any other questions, comments, thoughts? Go ahead.
Okay, so I know Susan Fernbach talked about adding a genetic counselor to the team's calls. How about having some of the students sit in on the ambassador calls? So they're going to be the ones working with families. And if they sit in on some of these calls, they're going to find out what makes the families tick the way they do.
I would be
a great idea.
Yeah, I would be open to
How
that.
how they can better serve those families. Does that
Yeah,
sound?
yeah.
That's a great idea.
Yeah, the other thing I would recommend too, Daphne, is that all of these calls are recorded as well and archived on our website as well. So if they're not able, I'm just thinking of logistics and schedule. If they're not able to join exactly when the call is going on, we have the recordings as well.
I'd love to see, this is Winton, I'd love to, I'd love to see students participating, because it's when you're a student, when you're a human in our modern world, you know, you write down that link, you flag it, and you're going to go see it. And often we don't go to all the links that we are supposed to go and see of recordings. So I think that's a wonderful idea to try and get, you know, students be here with us live, because they can also, you know, put in their 2 cents and share.
I agree.
All right. Anybody have any other ideas before we close?
Well, this is
on the line. Go ahead, Rosie.
Job.
Yeah, this is Rosie. I just wanted to listen today to get caught up.
Yeah.
But if I think of something I need to add, I will send you an email.
Great. Tell us, Rosie, because you mentioned that you represent or have represented in the past the sickle cell community and worked a lot with them. What are some things you think primary care doctors, pediatricians, you know, might be helpful for that community in recognizing that? I know that's one of the newborn screening conditions, but do you find there's people that are missed by that or diagnosed later in life?
Well, when I worked for the community program for 18 years in Alabama, and newborn screening was the focus of the community program.
Mm-hmm.
So we kept up pretty much with, they were tested at birth, so that diagnosis was early. That was the early diagnosis. But the follow-up was where we had, you know, to concentrate on, especially with some of the young mothers or people move fast, you know, by the time we got their test results, they were living in a different location. So the follow-up was where we put our focus.
Right. Gotcha. And were you doing a lot of that follow-up through pediatricians and primary care doctors? Were they a part of that follow-up team?
Yes, because we were broken down in regions, and in my region in Mobile, we were attached to the University of South Alabama.
Okay.
So we made referrals of everybody that we identified that had a positive test for sickle cell disease.
Gotcha.
Yeah.
Okay. Well, thanks. If you think of anything else, definitely send me an email. You can find me at kweese@mountainstatesgenetics.org. And it's on the website too.
Okay.
Okay.
Hey, Christy?
Yeah.
Do we know when the next Zoom meeting is? Do we have a date?
I do not have a date out for it yet. We're waiting for just a couple more meetings to be scheduled that are also going to be on a quarterly basis. So I'm trying to make sure that they don't overlap. So one of the things that I wanted to do, because we talked about this on the last call, was looking at the day and time. So this time does not work for everybody, as you can probably well imagine. So I did want to send out a doodle now that we have the list, the genetic ambassador list. You know, there were some people that said, I can't do it this year, I can't do it this month or whatever. So now that we have that list updated, I wanted to send out a doodle poll just to get an idea if, you know, this time is better for the most people, or is an evening time better? Because I know with some people with their work schedule too, depending on which time zone you're in, since we cover 4 time zones in our region, it's tough. So I don't have a specific for you right now on that. Does this time, I'm guessing probably this time works for you guys because you're here, but I don't know if an evening time might work better for more people. it might be worse for some other people. So
Okay, thank you.
yeah, that's why I tried to record them, just so it's, you know, if you do miss it, you can still get the information.
Here's another question for you.
Sure.
I would love if it would be possible to send us your PowerPoint slide presentation like ahead of time, even if it's an hour ahead of time, just because I know it's going to be posted. Sometimes there's a lot of information and I can't write it all down, but I'm interested, but then I forget to go to your website.
Okay.
Whereas if I have them with me, I have them with me, and it just would be helpful.
Okay. I will try. Today I was working on it up until 2 minutes before I put it up on the screen. So I've prepared 5 presentations this week. So,
my goodness, I hope you take time to take care of yourself.
I've got 2 more to go before tomorrow. So I will try. I did want to show you, I'm gonna just get out of this real quick and see, for those of you that are still on, this is where everything is, just to familiarize yourself. For the genetic ambassador, I just cleaned this up, so to speak, and so I archived everything from the last grant cycle here. So every call is here, and I try to put this topic so you can find it easily, and then the PowerPoint is there as well. So just if you're looking for anything, you can find it. Again, I kind of put it all in that one link there, and then I will add to this the current stuff. So it's kind of all in one place if you need to go look for it.
Hi, Christy. This is Hannah. I just wanted to chime in on the red flags. Having worked in Alaska in the genetics program up there for pediatrics genetics, one thing that was really evident is we did have families that unfortunately we were not able to serve anymore because they were adults. And so it was later in their journey that they were diagnosed. And so unfortunately we focused on pediatrics. But yes, red flags is definitely very important. I think we need to reach out to pediatricians, primary care providers. So it doesn't necessarily have to be pediatricians. It needs to be all primary care providers, to let them know that, you know, there are steps that they can take as far as what to do to identify if a person does have a genetics condition. And a lot of that is going to depend on the family, you know, for them to be advocates for themselves. Right. And then also, I think the communication, I think that's what we need, is the communication between family members and the medical community, for that to be stronger, for them to be open to suggestions from family members to say, hey, I noticed this about my kid. What can I do about it? Is that something that's, you know, unique or not unique? Or my kid is not, you know, talking and they're already 6. So those kinds of things, I think it's really essential. And so red flags, I think we need to push for that.
Okay, I'm glad to hear that. And I really feel like the 40 clinic initiative is a drop in the bucket, I know, of you think 40 clinics across our 1 million square miles. But I feel like it hopefully will be a start of establishing some of those genetic champions across our region. And hopefully that will trickle then outward, like little stones dropped in a pond, right? To other practitioners, right? That that we can use things like you're doing in Nevada with the partnerships with the AAP and the nurse practitioner organization, and Texas is doing some with nurse practitioners. And so using those organizations, but usually what I find in our state teams, right, is you want to give them something, right? You want to give them a resource. You want to give them something tangible to engage them or to share on their website, like you guys just did. So that's why I was thinking, I have not seen, if anybody's seen anything out there like it, send it to me, but I have not seen a red flag document by parents, by families. It's always from the clinical side of things. And so I think that might have a little niche there to have a unique resource saying, these are families reporting on this. This is what the family noticed first.
Can I ask a little question? All 4 of those flags that you put up were true of Grace when she was born. but yet she never ever had a genetics referral from any physician. But I did have one physician when she was in middle school say she has Grace Owens disease. But I mean, he didn't think about, well, you know, maybe we, so I don't know how many people get to be her age. I mean, she just turned 29 this week. So how many people are out there and they're still suffering without a diagnosis, but yet they don't even know, or nobody knows that is involved with their health care, that they really should get a genetic referral.
I think the problem, Susan, is that when our kids were little, the genetic testing was not
done
as readily available, and there wasn't as much known. And you've gone on so long now that it's just part of life. And why should you go through genetic testing now? Because that's for young kids in her mind.
Well, I mean, I think we need to recognize that this hole existed, and so what we need to do about it now.
Yeah, I think that's a misconception where we have to break, right, Melissa? Is that this happens in younger children. I think that's what Winton was talking to earlier as well.
Exactly, and that is something we have talked about on our calls on the Texas team. Are you familiar with the study that Baylor Genetics is doing in Houston? It's for people over the age of 18 who do not have a genetic diagnosis. If you don't have it, we can send it to you.
I'd like to get a copy.
Remind me, Melissa, though, was it for
what's that?
Melissa, was it for was it on intellectual disability or no?
Let me look real quick.
Okay. Yeah, I know I posted it on the Facebook page quite a while ago. I don't have it at my fingertips.
And I think it's double. It's not just that, oh, well, we've already gotten this far, so why do the testing now? It's also perhaps on the professionals end, saying in now this day and age, you know, for maybe teens, or those screenings probably were done. I mean, we don't think so much about screenings because the young, you know, the pediatrics for the younger, you know, population have already considered that. And same with the parents. The parents may be thinking like, or may not even think, but like, oh, well, our pediatrician would have caught those things because that's what they do and that's what they study and that's what they know. And that's where our assumptions can be hurting our children. And
I think that's one reason why it's so important for consumers or patients to be part of the educating of our medical professionals, because often they don't know how consumers really feel, because they're actually required to be taught how to talk to their patients, but who teaches consumer totally and the patient totally in that whole thing. So I know that when I do consulting for the College of Medicine, my take is so much different than the MDs that are teaching. It's not even funny, but that's why we need to teach our primary care docs, pediatricians, family docs, internists, whatever, the importance of listening and recognizing things out of the ordinary. And it's extremely, so it's not only difficult for the parent or the person themselves, but it's extremely difficult for the professional usually. Now, we have had some that don't need to be working with people, but you know, it's really important that we educate our physicians on that.
Yeah. Very good point, Daphne. Well, thank you guys for sticking on and having a conversation. It was great to see you all, and look forward to these new initiatives, and let's talk in 3 months. I'll get some things together Melissa, did you find something?
I think so.
If so, you have Susan's email, right? Or if not,
yes,
send it to me and I'll forward it. You have Susan's email? Okay.
Yeah, send it to me too, please, Christy or Melissa.
Yeah, I'll send it to
Winton too. Okay.
Yeah. Cool.
Thank you.
Thank you.
All right.
Everyone
Bye-bye,
be
guys.
well.
See you later. Bye-bye.
Bye.
Bye-bye.